Hello, everyone. In this episode, we have Dr. Clay Dorenkamp. He's a fifth-year orthopedic surgery resident. He also has a website called the OnCallMentors.com, and it really is there to allow pre-med students the right information so that they can make an informed decision when it comes to going into the medical field. I think it's a great resource. I think we had a very nice conversation about Clay's pathway through medicine, all the way to his current state or current place as an orthopedic surgery resident. I think it's also a great time for us to post this because we just had match day last Friday, and it's a very exciting time to go through medical school and match in your preferred specialty. So we had a great conversation on Clay's path through life and to where he is now. And I hope you guys enjoy this episode of The Happy Doc. As you're listening in, if this episode makes you think of someone that might find this content helpful, please share it with them and let them know about The Happy Doc and, of course, this episode with Dr. Clay Dorenkamp. Have an awesome day and stay safe. Hello, everyone, and welcome to another episode of The Happy Doc. This is your host, Dr. Taylor Brana, and I'm really excited for our next guest, Dr. Clay Dorenkamp. He's an orthopedic surgeon, resident in his fifth year, and I'm really excited to speak to him about many topics. And before we hopped into this episode, it sounds like our philosophies are aligned. And there's a lot of stuff that we do in our work to help medical school culture and beyond. So I'm really excited to have this conversation. Clay, can you introduce yourself?
Yeah. Hi, my name's Clay Dorenkamp. Like I was just introduced. I'm a fifth-year orthopedic surgery resident. Helping pre-meds and everything has been in my interest for a really long time. I started doing pre-med lectures as an early medical student. So really excited to be on here and have a voice to kind of help and reach out to everybody that listens to The Happy Doc.
Awesome. Well, thanks for, spending your time with me. It's, right now we're recording this on a Saturday morning, you could be doing lots of other stuff. So, it's just great to have you here and for you to spend the time on this podcast. And I think that really shows, you're very aligned with your mission to help people. So that's great. So, before we begin with, a lot of the work you're doing with your website and your blog, I'd like to just hop in and understand, what was that intrinsic motivation or what was that story that brought you to the field of medicine?
So, I actually started my journey into medicine when I think I was about 16 years old. I got this kind of random opportunity to go shadow a friend who was an orthopedic surgeon. And he actually let me come into the OR with him. And I remember that first experience just, like it was yesterday. I was standing in the corner, terrified. The smells were all different than in the real world. And he was doing a total hip replacement. And I remember that he, on a total hip replacement, you replace the femoral head. And one of the first steps of the surgery is you cut the femoral neck and take the head out of the body. And they actually just discard it. So they passed it off the field and they handed it to me. And I was like, holy cow, like I'm actually like holding part of somebody's hip in my hand. And from that point forward, I was instantly hooked. I started shadowing that same doctor multiple summers in a row and really just got me hooked into the field of orthopedics, which kind of helped drive my education there forward. We, in Colorado, I went to Colorado State University for undergrad, and they have the unique opportunity they have a cadaver lab, which kind of pushed me to that, really amplified my interest in anatomy and helped push me to medical school. So I got really lucky to have strong mentors in my life. And, it was one of my reasons I'm so passionate about mentoring people.
Yeah, that's great. And I love that story. It's so visual. The one thing that, as you were saying, that came into my mind is, this surgeon or the team, they're handing you this the femoral head and you're holding it. and you said you got hooked, and it made me laugh because I feel like that would have scared most people. You know what I mean? So I think it was a match made in heaven. It seems like. It's really funny. That's great. So let's fast forward a little bit into life as pre-med transitioning into med school. I know that we're both passionate about that. So what were some of the things you experienced in that transition? What are some things that you didn't expect? How was that part of your training for you?
Yeah, that's a great question, because I think that's one of the hardest things to actually understand as a pre-med going into medical school. I remember pre-med. I had a lot of fun in pre-med. You make some really great friends. Pre-med is hard, and learning the general chemistry and the organic chemistry and the physics, and then tackling the dreaded MCAT, which I think is probably every pre-med's worst nightmare. So one of my worst experiences was with the MCAT. First time I took the MCAT, I did terrible. Mm-hmm. It was like everyone's worst nightmare of a day. They changed the test room location on me the day of the test. I couldn't find the test room. And then there was like sidewalk construction outside the test room. So there was jackhammers going the whole day. And I ended up bombing the test. And when you get that score back on the MCAT that you see and you're like, this isn't anything compatible with getting into medical school. And especially at this point, I'd been focusing on getting into medical school for almost 3 or 4 years at that point. It was pretty devastating.
Yeah.
So that was one of my early experiences where I had to really kind of do some soul searching and go back to square one and start restudying for the MCAT again and retake it. And fortunately, the second time my study techniques were better. I was better prepared for the test. I was better prepared for the environment and did a lot better. Getting into medical school, I always hear the analogy of when you're an undergrad, it's like drinking from a garden hose. And then when you get into medical school, which I'm sure you probably understand this as well, when you're in medical school, you're drinking through a fire hydrant. I was like, okay, it can't be that bad, right? Like people do this, like it can't be that impossible. And then I remember my first week of medical school, our first biochemistry lecture, the teacher summarized everything that I learned in biochemistry in one day. I'm like, oh crap. And then you get through, and then the first semester is always a pretty good learning curve on just how you're going to study, how you're going to take exams, how you're going to fit into your school schedule. And then you adapt to it. And you just realize that this is your job right now, and it's going to take most of your free time, and you use your support around you, and your fellow medical students and your fellow classmates are always fantastic, and you just find your group and you help each other through. One of the biggest struggles, I think, with medical school in saying that is that you have to realize that this is a sacrifice and that you have to dedicate most of your time to it. I think you're able to go to some of your family events, but there's definitely family events and special occasions that I missed and was studying for my boards or studying for my big biochemistry test. Or I think that was probably one of the hardest things is you realize that this is what you're dedicating yourself to.
Yeah.
So, I think probably one of the hardest things that I experienced through medical school was the match process into residency. Mm-hmm. I think that's, when you're applying to medical school, you always know that there's a second chance or a third chance or even a fourth chance. When you're applying to residency, and you're familiar with the process, but it very much feels like a one and done opportunity. You get your one shot at matching into the specialty of choice. And, unfortunately most people do. I think most people get into their desired specialties, but it also, puts added pressure on you when you're at the beginning of medical school as well.
Yeah. Yeah. So, as I'm hearing a bit about that journey, we were actually talking about this a little bit earlier. It's very important, when people are thinking about this process, no matter what step of, the game you're in, but especially as a pre-med and you're thinking about entering this world, it is definitely, as you said before, you want to set up realistic expectations of the process and not unrealistic expectations. And I think you and I are both agree on this. I think I kind of went into it myself, wide-eyed, excited, felt like this was going to be, something that was going to take my happiness, my fulfillment, my excitement for the world to the next level. And it was extremely challenging. I think there's a lot of things I learned through the challenge, and I know you and I agree on that as well. But it is definitely something like, look, you're going to enter a grind. You're going to enter a phase of life that is hard, is difficult, is competitive. And you are going to have to grit your teeth and be uncomfortable and operate in a way that isn't you for a while, So I think I appreciate, kind of the realism you definitely painted, in a lot of that process. And especially with match, like you just mentioned, match is this part where, you can maybe match the second time or third time, but it is a lot harder if you're not as fluid in the process. And especially it's heartbreaking for people who don't go into their desired specialties right away.
Yeah.
But you went into ortho, right? And ortho is arguably one of the most competitive fields to get into. Obviously, there's the stereotype. What is it? Your board score and your bench press has to be higher than 500 or something. I don't know if I'm sure you've heard that one. But so what was the, you chose ortho, you knew it was going to be hard. So what did you have to do to kind of prepare and get into that mindset? And then what was that transition like?
Yeah. So becoming an orthopedic surgeon, I really started day one of medical school. I knew that, I had to do well in all my classes. I knew I had to do well on my boards. I really, from the beginning, I took it day by day and, do well on this test, and then do well on the next test. And then that all leads to doing well on boards. And then I had a successful, what we as DOs call a audition rotation, or what the MD counterparts call a sub-I. I had successful sub-Is or audition rotations, which thankfully I was, with a lot of preparation and a little bit of luck, got me into my residency. Residency's hard. And one of the things that makes it hard is you're expected to study and learn as much as you did in medical school while working a full-time job. And then you start having to balance a family life into it as well. Because life continues to evolve even while you're a resident. And I think, because when you're in medical school, you basically just study full time. When you go to class, you're studying. When you're, at home, you're studying. But when you're working your job, which is a learning experience, but it's also still work. And then you have to come home and, if you get home late, you still have to study, or you wake up early and study. And then the other aspect of residency that is also difficult to get used to is the fact that your decisions matter, and that even though you're supervised, you still are one of the frontline healthcare givers to the patients.
Yep.
And that really adds a level of difficulty to your thought process and how you make your decisions and how you read and how you study at night. So I think, that's where we're starting to see a lot of what people are calling the imposter syndrome now.
Yep.
Too, which I know you had a great great podcast episode on as well.
Oh, thanks for listening. So I think, you brought up a really good point. When I think about that transition, I remember, so my first rotation, going into residency was, EMed. So we have to do a required emergency medicine rotation as part of, our curriculum. And, literally the first day, as I'm going from med school, obviously to residency, not to get into details, but my first patient I had to place an IV. And I literally went over to our computer, because you have to put in the orders into the computer. I placed it, and then I see the nurse look at me, and we walk over and then place the IV together. And I'm like, wait a second, like I decided to put this IV in. We went over and we did it, and I was like, what just happened? And my brain like exploded. I was like, I did that. It's definitely you take your, USMLE, you take your COMLEX, whatever exam you're taking, and there's always these crazy questions and you have to make a decision. But in real life, you make the decision and then it enters someone's body, or that decision affects that body. And that was a really weird moment. Now it's pretty natural. Obviously in residency, you do it all the time. It becomes a natural thing. But that is a strange experience.
Yeah, I completely agree. And I have so many stories where I was in that exact situation. It's incredible. I think that's one of the coolest things about residency is you go from that first and second year position where you're just like getting comfortable affecting somebody's life, basically, to where you gain your confidence and you are doing the same, like doing more complicated things as a senior resident, and being so confident about it and knowing what you're doing is the right thing and helping somebody. For me, it's being in the ER, reducing, a 3-year-old's broken arm, or, being in the OR and fixing complicated fractures, or I'm doing an orthopedic spine fellowship. So I do a lot of spine surgery as well. Mm-hmm. You're working, we do a lot of cervical spine surgery, which is right up, there's a real risk of paralysis and real consequences, but seeing the benefit you get from it and having the confidence doing the procedures it's a pretty incredible transition. And I know when I was a young resident, you're really stressed out and you're like nervous going to work every day. And then as a senior resident, you leave work and you're like, wow, that was a really cool day. That's a really cool job.
Yeah. No, that's amazing. I love that. And I can hear the passion, you're definitely excited about it when you come into work, which is, one of the reasons I'm excited to have you on the Happy Doc, right? Because I think there's a difference between someone that comes into work and doesn't have that passion. But for you, it sounds like you really enjoy being in the OR. You enjoy the process of learning and doing this thing. Would you agree?
Absolutely. And it's not always easy. There's definitely hard days still, and there's definitely situations where I get uncomfortable. I think like one of the biggest transitions in mentality, and I think is one of the things that we're going to find with the imposter syndrome and getting over the imposter syndrome is being self-aware that everyone gets uncomfortable. Even your attendings get uncomfortable in situations, but knowing that you have the support and the backup and the training to recognize that and know when to ask for help, I think that's when you start to see the freedom and really find the joy in your practice. I think the old mentality of medicine of where, as the doctor, as the surgeon, you should be able to, do everything, know everything. And with the vast expanse of medical knowledge recently, and like the thousands and thousands of orthopedic procedures, or the hundreds of different psychiatric medications there are today, there's no way that one person can know everything.
Yep.
Actually, yesterday I had to go to a training class, and for one of the hospitals I work at, and the the guy teaching it was a retired fighter pilot.
Okay.
And so it's another very high stakes field. And one of the things he said to me was, or one of the things that resonated with me was that he goes, every flight I took, he goes, I made a mistake. And for some reason, like as a fighter pilot, it's kind of like being a surgeon. It's like every mistake can be fatal or cause a bad complication.
Yeah.
But knowing that humans are fallible and knowing how to build your support system around that and to build your systems around that, to recognize where the complicated things are and when it's okay to ask for help, I think really helps physicians not get burnout and live a better life, ultimately, which is what we're hoping to educate people about.
Yep.
Because it allows you to have less stress in your work and remember why you were doing that and focus on helping people instead of feeling the burden of being the only person in the room that can solve the problem.
Yeah. Yeah, no, absolutely. And I think that is a powerful statement you made about the mentality transition. It's, I think early on it's kind of like when you first start medical school, actually. So I like that we kind of went through the whole gamut here, but it's when you first start medical school, you want to kind of act like you're smarter than you are. And this almost like, way to show your confidence, but really everyone's freaking out. And it's only, I think, that point in med school when you start to get comfortable, quote, asking the dumb questions or advocating for yourself or really actually saying what you know and what you don't know, that you really learn, right? And it's the same thing with residency, where I think everyone enters in their intern year and they want to show that they know a lot. And sometimes people do, which is great. But other times you want to lower and be a little bit more humble so you can ask for help, so you can make sure you actually do know what you're talking about. Because now, if you didn't get it in med school, you definitely need to get that idea in residency, because now you're affecting people's lives. Yeah. And, for you, if you don't ask for help on, for example, how to get that hip replacement lined up, or make sure that the ball and socket joint is fitting in properly. If you don't understand the mechanics of that procedure, you're literally going to have someone limping out of there and not have an effective procedure. So it's even more important along those steps to realize you have to get out of your own way to learn to help other people, which is very difficult.
Yeah. And I think that's something that historically medicine has done a terrible job with. It's always been this really cutthroat environment through medical training. And I think hopefully the next generations of doctors will start to break that down a little bit. And, that's one of my big goals with my website that I started, was trying to connect young aspiring physicians, medical students, residents to more seasoned physicians, or even, medical students to senior residents or young attendings, just to help break down some of those barriers.
Yeah. So let's get into that. So you have this website. It's the oncallmentors.com.
Yep. I
know it's a blog. It's the website. So if you could give me like your, 30 seconds to a minute elevator pitch, what are you looking for? What's your mission? What's your vision? What are your goals?
Yeah. So our mission with this is, like I said before, is really improving access for pre-med students and medical students to residents and attendings. My overall goal with the website is that I want to have a venue that pre-meds and medical students can ask questions and get reliable information from current docs. That way they know what they're getting themselves into. And we can help provide mentorship and guidance and to people so they aren't disappointed when they become doctors. And, hopefully this helps decrease someone's burnout rate or decrease job so they're not dissatisfied with their jobs or whatever.
Right.
And it's just to answer questions in general. if you're not from a medical family, getting access to ask a doctor a question as a pre-med about what life in medicine is like is really hard.
Yeah.
And through social media and the websites and Instagram and whatever platform you want, we have the technology to connect these people. And I'm not interested at all in, having some big paid service where you pay $500 a minute to talk to a physician. I want this to be, something that's accessible and hopefully something that I never even have to charge a medical or pre-med or medical student for.
Right.
So that's kind of what got me started on the project. And I went and recruited several of my friends from medical school who went into a vast range of specialties: emergency medicine, ophthalmology, dermatology. I'm orthopedics. My friends went to PM&R. And we kind of came together and just started writing these short blog posts, and it's kind of evolved from there. We also created a group on Facebook with this same mission, which I think has probably been the most successful part of it.
Okay.
We just surpassed 1,000 members on it, which I think is fantastic.
That's great. That's great. What's the Facebook name, the group name? It's
the On-Call Mentors.
Awesome.
So, and that I really encourage, with the help of, SoMe Docs has been very helpful in this, helping me recruit some other physicians into the group forum for the pre-meds and medical students that they can ask questions. And we've had some really good conversations and hopefully help some pre-meds make some decisions about their futures.
Yeah. Yeah, that's great. And, something you said in there, which I thought was very powerful as I was listening to it, is I don't come from a medical family, right? I don't come from a family of physicians. And I think this actually comes back to the point you made earlier, which is we have unrealistic expectations of what this experience might be. If you come from a medical family, I've had several interviews about this. You saw dad work the late hours. You saw mom have to take calls and balance that with taking care of the kids. You saw these, individuals in your family that had to work crazy, strenuous hours. What we see on TV is, the show Scrubs. Scrubs is actually fairly accurate in some ways, which I think is great. You see Scrubs, you see like the new show out, The Resident. What's that one show with Dr. McDreamy? Why is this going words? Anyways, doesn't matter. But if you watch these TVs and these dramas, right, you're not getting the accurate picture. You're just getting a dramatized, looking at the highlight reel of medicine as opposed to what it actually is, which is, again, those sleepless nights, crazy call schedules. Obviously we can go through all of that, but I love that you're creating this resource and you're part of a team to inform, which is, as we often talk about in medicine, any decision requires a proper understanding of the risks and the benefits. And you want to make an informed decision. And, I often have this conversation with med students, I don't know, or pre-med students. I wonder if you have the same, which is how many rotations have you done, or how many shadowing experiences have you actually had?
Yeah.
Because again, if you don't shadow, if you haven't actually seen the life, and even shadowing is a little bit of a skewed look at it, because I often feel like when I have a student shadowing me, or if I see students, we want to give them the best experience. But the truth is, it's not always the best experience, right? So
that's very true. And I think you bring a really good point, is shadowing, while it's great, and I think it's hugely beneficial in your path to getting into medical school and learning about medicine, shadowing isn't the real picture always. Shadowing, you don't see what happens after you go home. Like, you don't see, unfortunately, I think every resident in the country probably comes home in charts after they get home. No one sees that aspect of it. Right now me and my wife is an anesthesiologist who just graduated residency, and
congratulations.
Thank you. And we're lucky we have a 6-month-old child this year.
Also, congratulations.
Thank you. And this year's been really challenging because I'm in my chief year of my orthopedic residency, and a large part of orthopedics is taking care of trauma cases. And a lot of trauma care goes on between 5 p.m. and midnight or 5 a.m. And so, I go sometimes been a week-long stretch of me leaving before my baby wakes up and me getting home after my baby goes to bed. And that can get really tough at times. And those are the sacrifices that you can't appreciate until you're living the situation.
Yeah.
Because that doesn't happen at the hospital. All you see is like, oh, this is really cool. Like, we did this awesome surgery. This person shattered their femur and we were able to put it back together, and now they can walk on it the next day. But the sacrifice at home, is not appreciable until you're the one getting home late and, missing that important time in your family life. And I think, I think the ACGME is actually doing a fairly good job trying to bridge that gap. But there's certain aspects you can't learn medicine between the hours of 8 and 5 p.m. You have to do the night work and the call work and the emergency work to be able to be a good doctor. So those sacrifices are always going to be there. But
yeah. I mean, I agree with you. I think that unfortunately, medicine is an all-time, it is one of the fields where it is 24/7. It doesn't stop. Anything can happen at 3 a.m. or 4 a.m. Like you said, I think one thing I definitely didn't realize, but obviously through experience, both of us realize, is that continuity of seeing the full spectrum of someone entering a hospital and then leaving, and understanding what can happen in the progression of different disease states. You can read it in a book, you could watch a video, but you can't actually appreciate how that happens realistically unless you do have those hard nights. And there is no way around it. But at the same time, like you said, it comes with a level of sacrifice that, in your case is very real. I have this newborn baby, and you leave for work and you come back and you never made that connection throughout the day. Now, did you have some awesome moments at work? Sure. But it comes at a cost. And I think you really painted that picture pretty clear.
Yeah.
Well,
I was just going to say, going off that, I think, there's a lot of things we see in healthcare with the upcoming elections and all of this stuff. And you see some of these older burnout physicians and even some younger burnout physicians that basically tell students like, yeah, I wouldn't go into medicine again. And I think that's a really unfair statement to tell a pre-med who's excited. The fact is we have really cool jobs, and no matter what happens politically, we're going to be well compensated for what we do. And we have a level of job security, which I think is pretty underappreciated as well. There's a lot of controversy with whether the different roles in medicine between the different levels of providers.
Yeah.
But really, if you get a MD or a DO and you're a resident trained physician, there's a job opportunity out there for you.
100%.
And I think that level of job security in general is something to feel good about your profession for. And then you can help people. You make connections throughout your medical school and your residency. You can help your family members by helping get access to subspecialists and whatnot. There's a lot of benefits that a lot of people don't fully anticipate besides just the bottom line of the dollar amount you make. So I still think this is a phenomenal field. and really happy that I went into it.
That's amazing. That's great. No, I loved that statement. That was, I think we painted a realistic picture, in this conversation, but I think there is a lot of room for optimism. And I mean, obviously I love talking about the positive parts of this. But I think in order to appreciate the positive aspects of the work, you want to first be able to expect the realism.
Yeah.
I think if you understand that realism, and like you said, understand there's a lot of benefits to being a physician. There's so many. That could be multiple podcasts about that. There it is a great field, and it is extremely fulfilling. I'd like to ask you, what are those most fulfilling parts for you? Like, what gets you fulfilled in your balance of life with medicine and the work you do?
Yeah, that's a fantastic question. I think one of the coolest things is when you see, like, especially in orthopedics, we do things, we're life changing, not life saving in some aspects, which I don't fully agree with. But we're able to give people back their motion. And I think you even had another podcast about life being about moving. And I think that with my specialty in general, having had patients where I saw that couldn't walk before surgery and then can walk after surgery, and like just seeing like how happy these patients are, that level of like gratitude that you see from those patients is remarkable. And to me, that's really what drove me into orthopedics to begin with. And being a resident now, while it's more directed at your attendings, like, you were there, you were involved in the process. Like that's really cool to see how well some of these patients do and how much you've helped them lead a fulfilled life by, something as simple as, I'll call it simple, which just because we do so many of them, is like a knee replacement.
Mm-hmm.
It's a big surgery. It's a big commitment to the patient, but you take somebody that couldn't walk with their grandkids, couldn't go to the park with their grandkids, couldn't take their grandkids to the zoo. And then you give them a new knee replacement and they can walk as far as they want. And you see that level of fulfillment in their life. That's pretty powerful.
Yeah. Yeah. One aspect that, with the procedural fields of medicine that is really powerful, and you alluded to it, is you get to see the result. You get to see the person that has their knee injury, or, obviously like completely they've worn down their hip or their knee or what have you, and it's just not a viable, thing to use anymore. And then you can come in and literally replace that and give them that mobility. You see the change right away. It's very different. And again, this could be a whole other conversation about the difference between specialties. Very different than what I do, which is in psychology and psychiatry. My work can often be very ambiguous, and it's unclear often what result I have. But if you're the type of person that you want to see like that moment, and then you were the one who had the effect, and that effect went into that body and then improved them. I mean, that's huge.
Yeah. I think you bring up a really good point, the difference between the specialties. And I think, every specialty we have in medicine is important. And I think that's one of the biggest things that I wanted to do with my community that I'm building, is bring someone from psychiatry and bring someone from PM&R and bring someone from general surgery. And that way we can have this collaborative community of different physicians say, hey, this is why I'm fulfilled in life. Like one of my good friends who's a family medicine doctor, he really likes the flow of family medicine. he likes taking care of people for a long period of time and helping coach them through chronic illnesses. Does family medicine have challenges? Yeah. Orthopedics has challenges. But it's what makes you fulfilled in your job. And that's really why I think it's so important to have a community of physicians, residents, medical students, and even pre-medical students where they can participate in these forums, in these conversations in a manner that can help someone say, oh, I thought I wanted to be a anesthesiologist, but it turns out like I don't like pharmacology that much.
Yeah.
Or I thought I wanted to do orthopedics, but really I would like to sit down and talk with my patients and coach them over a longer period of time. So I think you're finding that why and why you want to be a doctor, and for every person that's different, and helping educate students earlier in their careers helps us get people into the right positions, and ultimately, hopefully, decreases burnout and imposter syndrome and the likes.
100%.
And I think there's a business philosophy too, that you can have like the right people in the wrong position and have an unsuccessful team, where if you took that person who's maybe a really good doctor just going down the wrong path and resituated or helped to steer them to a better path for them, then it improves healthcare overall.
Yeah. Yeah. It's called I actually had a podcast episode about this. It's the player position phenomena. And you can have the right player on the wrong team. You can have the right team and the wrong player. And you need both the cultural, you want to have team alignment where the culture of the team you're in is effective, and you should make sure that you're an effective player in the position that you're playing. So that's a great point, and that's a whole other conversation. For the sake of this conversation, I know we talked about a lot, and I would love for us to kind of wrap this up. We talked about a lot, your pathway going into orthopedic surgery, the things that get you excited about it, the realism of what is going on. Obviously, you have your website, the oncallmentors.com, and the On-Call Mentors Facebook group as well. Was there anything you wish that you would have touched on, or anything else that you'd like to say before we close out today?
No, I think we touched on most of the things that really drive me to help the upcoming doctors, and hopefully even help some current residents, and maybe even inspire some attendings, even though I'm not quite there yet in my own journey. I think if I was to close out, I would say, our goal is, as soon to be attendings or senior residents who are just finishing the process, is that we should really encourage our peers to be encouraging to the future generations of doctors, and reach out and help mentor people and help steer people to why they should, or even why they shouldn't be a doctor. If we feel someone's going down the wrong path, I think it's our responsibility to have that discussion with them and say, this might not align with your overall future goals. I think and then I just want to be encouraging to people. If you want to be a doctor, there's lots of ways to be a doctor out there, whether you're an MD, a DO, if you even want a foreign grad or a Caribbean school, there's a lot of different conversations you can have about that. But I would say don't give up on your dreams. There's a lot of resources out there for people, and that we're always willing to help in whatever way we can.
I love it. Well, that was a great closing. I don't have anything else to say. I think you're right on the mark there. Dr. Clay Dorenkamp, orthopedic surgery resident, pretty soon attending, right? I'm very happy for your time on this podcast today. And I want everyone to check out the oncallmentors.com website. Also check out the On-Call Mentors Facebook group. it sounds like a fantastic resource that you've really put together. And I think it's going to, help those pre-med students, those med students that really are looking to, connect to those higher levels of the process and understand what they're getting themselves into. I think that's great. So thank you.
Thank you.
All right, there's the episode today with Dr. Clay Dorenkamp. I hope that you enjoyed that episode of The Happy Doc. If you did, please consider subscribing to the podcast and sharing this episode with a friend or someone who you think might find this episode helpful. I would also encourage everyone to leave us a 5-star review on iTunes. It's one of the best ways to support us. Have an amazing day, stay safe, and I'll see you on the next episode of The Happy Doc.